Hello everyone, welcome to Pediatric Dermatology by Dr. Anand and Dr. Anurag. So today's topic of choice is this: what can you see in this child? What do you think? Can you see this? Can you see any specific well-defined erythematous patch surrounding the mouth? Well-defined erythematous patch surrounding the mouth. Number one. Number two, if I give you a history that the mother tells that baby licks his tongue a lot. Doctor, he licks his tongue whole day. He's licking his tongue out and out around his mouth, and I tell him not to do, but he doesn't listen to me. So typical this history and this patch surrounding the mouth. What can you think of? The best diagnosis we can make out is anyone? Yes. So it's a case of lip licher dermatitis. Lip licher dermatitis. Have you heard the name? So the important points. Number one, the mother asked doctor, at what age my baby can have lip licher dermatitis. So you should say that, madam, it is very common in the school age children. It is common in the school age children. Number one. Number two, it is seen in babies who have difficulty with impulse control. Difficulty with impulse control. Okay, seen in those babies. Number three, any babies with the children with cognitive impairment. Cognitive impairment, it contributes to compulsive lip liking. Okay, these are very wonderful points, so please remember. Okay, next question. Mother asked that, doctor, how does this why the lip liking will cause dermatitis? Any idea why? If I do too much of licking my lips with my tongue, why it will cause dermatitis? Now for this you need to know something known as wet dry cycle. Wet dry cycle, see, it's very easy. Now listen to me very carefully, it is very easy. Point number one, lip liking basically, it may begin with or without an initial stimulus. Okay, it may begin with or without an initial stimulus. Point number one. Point number two, which initial stimulus you're talking about, sir? See, it could be a dry weather or a cold weather. If the weather is too dry and I start licking my, I'm trying to lick my lips with my tongue. Are you understanding? That's a stimulus. But without stimulus also, I can start licking my lip. Then what happens? Then I will have this unconscious habit, this constant unconscious habit of licking my lip, and I'm wetting my skin with the saliva. Do you agree with me? I am wetting. You are wetting the my skin around my lips with the saliva. So what happens? I'm licking my the skin around with my tongue, and I'm wetting it. Then later it becomes dry. Again, I'm trying rolling out my tongue around my lips. Are you understanding? That is known as wet dry cycle. So this constant wet dry cycle. Wet means that I'm licking my tongue through my tongue. I'm licking my lips. That is wet. Then it will become dry. Again, I will roll out my tongue around my lips. That is wet dry cycle. So this wet dry cycle, what happened? Repeated wet dry cycle basically of saliva. What happened? It disrupts the normal skin barrier and causes inflammation. Okay, and this only inflammation later it will lead to lip licher dermatitis. Okay, what are the clinical features? The mother asks you, doctor, how do you diagnose this case? What are the clinical features if my baby is having lip licher dermatitis? So number one, there will be a chronic redness, dryness, and scaling of the lips. You can see in this child also. Mother told me, can you see it's a little dry? Can you see, like the mother told, it's a long duration chronic redness, dryness, and scaling of the lips. Okay, surrounding the skin. Okay, scaling of the lips. Are you understanding? Yes or no? And wherever the patient's tongue will reach, that whole area will be red, dry, and scaling. Number one. Number two, this area of inflammation, basically the area of redness, it frequently crosses the vermilion border of the lip. I'll show you one picture, beautiful picture. Can you see now? This is the vermilion border of the lip. So this area of inflammation or the redness, it crosses the vermilion border of the lip, means wherever my tongue will go, the whole area will be red around my lips. Okay, and these symptoms can get little worsened during the winter time, and it accompanies by patient complaints of burning and dryness and burning like that. So it's a habit kind of a problem. And how do you diagnose it? It's a clinical diagnosis. I can see a characteristic appearance of this area erythematous patch, and there is a history of lip liking, so I will think about lip licher dermatitis. And again, in this cases, do you need a skin biopsy? Skin biopsy is generally not indicated in these conditions. Okay, doctor, what are the complications of lip like a dermatitis? My child has this very bad habit of licking the lip, so what are the complications, doctor, which I should be aware of? Okay, so number one, it is a benign habit. It is a benign habit, nothing to worry, but it has significant possible complications. Doctor, what are the complications? See, too much of skin your baby will lick, no, through the tongue, so that skin barrier, the whole skin will break down, and that will lead to, number one, secondary bacterial skin infections. Could be a staphylococcal or yes, or could be a candida or any yeast infections, yes or no? So number one, secondary bacterial skin infections. Number two, chronic problem, chronic inflammation can lead to post-inflammatory hyper or hypopigmentation. Can you see in this child little black hyperpigmentation? The typical chronic inflammation of this problem, which can lead to long-term post-inflammatory hyperpigmentation or even hypopigmentation also. Are you understanding? These are very wonderful points. I mean, it covers a very wonderfully, the topic has been covered. Okay, last, what are the differential diagnosis, doctor? If it is not a lip like a dermatitis, what else I can think of? Number one, you can think of allergic contact cheilitis. Allergic contact cheilitis. Okay, what is cheilitis? Cheilitis is inflammation of lip, cheilitis. Okay, so yeah, the differential diagnoses are, number one, allergic contact cheilitis or allergic contact dermatitis, which is nothing but a kind of a hypersensitivity reaction following contact with an allergen. Okay, with an allergen. Okay, and it is localized. Second differential diagnosis is periorificial dermatitis. Orificial dermatitis. Okay, but the thing is, like, this periorificial dermatitis does not involve the vermilion border of the tip basically, and lip like a dermatitis, it does involve. That's what the book says. And what is the treatment of lip like a dermatitis? What do you want to give it to this child? So okay, number one, of course, behavioral modification. Don't you agree? Don't you want to do a behavioral modification for this child? Tell the mother, counsel the child, it is not a good habit, it is a bad habit. Why don't you try to, divert your mind? Why don't you stop doing it? It's a very typical history. Mother comes and tells you कि ये बहुत ज़बान बाहर करता है. In English, she tells that he puts too much of lip liking around the tongue, around the mouth, around the lips he does. So number one, behavioral modification will be a very good choice. Number two, emollient lip balm. Any nice emollient lip balm you can give. Number three, some book says that mild to moderate topical corticosteroids, mild to moderate strength topical corticosteroids ointment can be really helpful. And in some cases they have also tried topical tacrolimus, which is a calcineurin inhibitor. So tacrolimus ointment or pimercrolimus, PIMERCROLIMUS, pimercrolimus or tacrolimus cream or ointment they have tried. Tacrolimus ointment and pimercrolimus cream. It's a topical calcineurin inhibitor. So these were the important points which you should know in general regarding the lip like a dermatitis, and the outcome also is really good. It resolves with appropriate treatment and appropriate behavioral modification. That's all regarding the pediatric dermatology by Dr. Anurag and Dr. Anand. Thank you so much for watching it, and for more such updates you can follow us on Instagram and YouTube. And for our free WhatsApp pediatrics group, you can WhatsApp us on 9999897081. Thank you so much and have a wonderful day.